I would like to ask you about the 988 lifeline. It just passed the House this week. Why did it not pass with all the other bills that passed last week?
Because it was necessary to implement the budget, it had a little bit more time to get to the Senate. But I was very relieved and excited that we moved it. I do have to say, I've worked on a lot of bills on suicide prevention, and this one by far can make the greatest difference and can save lives. And we heard so much powerful testimony, people sharing their own stories, their own struggles on the floor of the House. I've heard so many people really needing help, and we know that we've seen a huge increase, 36% increase in suicides over the last decade. We've lost 5,000 people in the last 5 years. And we lose 2 to 4 young adults every week in our state to suicide. And so this action to have services and supports in place is so critical. And so I'm really proud that we were able to move the bill over, and I hope its hearing goes well in the Senate.
Sometimes people don't know what to do or who to call, then the outcomes can be extremely tragic in some cases. Can you talk about that?
Yes, I think a lot of people don't know what to do when a loved one is suicidal. And for most people, they call 911 and they have an officer arrive at their door. But, officers don't necessarily have the training to help someone in a behavioral health crisis. In fact, we know 1 in 4 shootings involve someone experiencing a behavioral health crisis. So again, we really want to make sure that people are getting the right clinical services and supports during a crisis. And again, I think we've underfunded our crisis system, and we really need to make new investments.
Another bill that is extremely powerful is 1109 for support for survivors of sexual assault. And I understand that you testified in the Senate recently.
Yes, the bill was heard this week, and I was really grateful to get a hearing. There were a lot of people that testified. Again, we really, in this bill, are strengthening the Survivor Bill of Rights, such as having an interpreter, access to a community-based advocate, and really key pieces. And, part of the testimony, and I'd like to share it with you, is a survivor by the name of Leah Griffin. And we met in 2015 when she couldn't get her sexual assault kit tested. And she has been a leader at the state level to really move these policies forward.
Hello, my name is Leah Griffin, and I serve on the Sexual Assault Forensic Examination Best Practices Task Force. And it's been an honor to serve there with Representative Orwall and Mossbrucker and Senator Dingra trying to fix a broken system for survivors of sexual assault. With your help, we are testing and tracking rape kits, we're storing unreported rape kits, and training officers. We're making progress, and today's bill continues that important work. Today's bill has important rights for survivors, and survivors need these rights. But more important, we need knowledge. We need assurance that the crimes are being investigated. For survivors, and I want to speak directly to Mr. McMahon's concerns, for survivors, trust has been lost in the police. And so it is essential that we have information, that we have numbers, and that those numbers are overseen by the Attorney General so that we can guarantee that the hits generated by CODIS are in fact being investigated. Last year, the SAFE Task Force recommended that we develop a public apology for survivors for the failures of the system. And Representative Orwall and I began working on that apology and quickly realize that we can't apologize until we can demonstrate that we've solved the problem. We can't say, I'm sorry your rape was not investigated if we can't show that investigations are taking place now. We need to see numbers. We need to see the racial disparities in investigations so we can confront a racist and biased system. We need accountability, and then we need to hear that apology. So I urge you to pass this bill and make sure that survivors have accountability.
So you just heard Leah, and I want you to know this is why I do this work, is for Leah and other survivors. We know that 1 in 5 women have experienced a sexual assault and 1 in 7 men. And so it's so important that we have a system to support people during what could be the most traumatic moment in their life. So again, I really hope this bill will do more to support survivors.